Assalamualaikum and hi. Today we are going to talk about our campaign, and before that I'm going to introduce our company. Our company name is Body Wellness Enterprise and we are from Group 1. We are specialized in overcoming your fears about eating disorders, and we are going to give you an advice how to cure and prevent it from happening. Together we are healthy without eating disorders. So let me introduce myself first. My name is MUHAMAD HAKIM bin Norman and I am the leader of this company. Today, we're gonna share to you about what is eating disorders and how seriously it's gonna be if we don't prevent it early. We know that eating disorders have the highest rate of all mental illnesses, so it's not something that we can just think lightly about. And it's very difficult to treat. So, in our campaign, we talk about our focus to make change is always meaningful engagement with decision makers to raise awareness and help understand what it means to experience an eating disorders and get across your passion to make change for others who are still suffering. So, why we do campaign? At Body Wellness Enterprise, we share the vision that eating disorder will be beating. And our goal is to end the pain and suffering caused by them. Healthy eating behaviors is based on two sensations, hunger and satiety. Eating disorders are disrupt this mechanism. This disturbance is a psychological consequence of malnutrition and can be reversed if diet is improved. Anorexia and bulimia, recognized as conditions in their own right, are two examples of eating disorders. It is estimated that 9% to 10% of adult women suffer from compulsive type eating problems. Men represent 10% to 15% of people affected by an eating disorder. These disorders are very often triggered during adolescence. So, after this, my friends will explain more detail about what is eating disorders and how it occurs, also the risk factor and how to prevent it from happening in the future.
Assalamualaikum and hi, my name is ISMAHADI. Now, I want to talk about what are eating disorder. Eating disorder are behavioral conditions characterized by severe and persistent disturbance in eating behavior associated distressing thought and emotion. They can very serious condition affecting physical, psychological and social function. Type of eating disorder include anorexia nervosa, bulimia, nervosa, binge eating disorder, avoidant, restrictive food intake disorder, other specified feeding, and eating disorder, pica and rumination disorder. Taken together, eating disorder affect up to 5% of the population, most often develop in adolescents and young adults. Several, especially anorexia nervosa and bulimia nervosa, are more common in women, but they can all occur at any age and affect any gender. Eating disorders are often associated with preoccupation with food, weight or shape, or with anxiety about eating or the consequence of eating certain food. Behavior associated with eating disorder including restrictive eating of avoidance of certain foods, binge eating, purging by vomiting or laxative misuse, or compulsive exercise. These behaviors can become driven in ways that appear similar to an addiction. Fun fact, eating disorder affect several million people at any given time, most often women between the age of 12 until 35 years. Eating disorder often co-occur with other psychiatric disorder, most commonly mood and anxiety disorder, obsessive compulsive disorder, and alcohol and drug abuse problems. Evidence suggests that genes and heritability play a part in why some people are at higher risk for an eating disorder, but this disorder can also afflict those with no family history of the condition. Treatment should address psychological, behavioral, nutritional, and other medical complications. The latter can include consequences of malnutrition or of purging behaviors, including heart and gastrointestinal problems, as well as other potentially fatal conditions. Who suffer from eating disorder? First, female, 2. People who feel like their life is out of control. 3. Victim of abuse. 4. Overachiever. 5. Teen and adult who were told they were fat as children. 6. Someone suffering the sudden loss of a loved one. 7. Individual with anxiety of depression. 8. Someone from a family that has pressure to be thin. 9. Someone who is the genetic relative of someone with an eating disorder. 10. Someone with low self-esteem. 11. Someone dealing with major life changes such as going away to college. 12. And last, someone facing issues with the hypothalamus and discontrol feelings. That's all for me. Thank you.
Okay guys, today I want to talk about symptoms and causes. Okay, symptoms I want to talk about anorexia nervosa, bulimia nervosa and bigger eating disorder. Okay, I want to talk about anorexia nervosa first. People with anorexia use extreme effort to control their weight and shape, which often significantly interferes with their health and life activities. When you have anorexia, you excessively limit calories or use other methods to lose weight, such as excessive exercise, using laxative or diet aids, or vomiting after eating. Effort to reduce your weight, even when underweight, can cause several health problems, sometimes to the point of deadly self-starvation. Okay, the second one is bulimia nervosa. Bulimia nervosa is a serious, potentially life-threatening eating disorder. When you have bulimia, you have episodes of binge and purging that involve feeling of lack of control over your eating. Many people with bulimia also restrict their eating during the day, which often lead to more bigger eating and purging. If you have bulimia, you probably preoccupied with your weight and body shape, and may judge yourself severely and harshly for your self-perceived flaws. You may be at a normal weight or even a bit overweight. Okay, the last one is bigger eating disorder. When you have bigger eating disorder, you regularly eat too much food and feel a lack of control over your eating. You may eat quickly or eat more food than intended, even when you're not hungry, and you may continue eating even long after you're uncomfortably full. But you don't try to compensate for this behavior with excessive exercise or purging. As someone with bulimia or anorexia might, embarrassment can lead to eating alone to hide your begging. Okay, the second one is I will talk about causes. Okay, the exact cause of eating disorder is unknown. As with other mental illness, there may be many causes, such as genetic and biology. Certain people may have genes that increase their risk of developing eating disorder. Biological factors, such as change in brain chemical, may play a role in eating disorders. Okay, psychological and emotional health. People with eating disorder may have psychological and emotional problems that contribute to the disorder. They may have low self-esteem, perfectionism, impulsive behavior, and trouble.
Assalamualaikum, I am MUHAMAD AMIRUL HAIQAL bin Mustafa, and I will explain the risk factor of eating disorder. First of all, eating disorders are complex and affect all kinds of people. Risk factors for all eating disorder involve a range of biological, physiological, and socio-cultural issues. These factors may interact differently in different people. So, two people with the same eating disorder can have a very diverse perspective, experience, and symptoms. But still, researchers have found broad similarities in understanding some of the major risks for developing eating disorder. The factors listed below may be applicable to those with anorexia, nervosa, bulimia, nervosa, binge eating disorder, or OSFID. For your information, teenage girls and young women are more likely than teenage boys and young men to have anorexia or bulimia, but males can have eating disorder too. Although eating disorder can occur across a broad age, they often develop in the teens and early 20s. Certain factors may increase the risk of developing an eating disorder, including number 1, family history. Having a close relative with an eating disorder, study of families have found that having a first-degree relative, like parents or sibling, with an eating disorder increase a person's risk of developing an eating disorder. Secondly, having a close relative with a mental health condition. Similarly, issues like anxiety, depression, and addiction can also run in families and have also been found to increase the chances that a person will develop an eating disorder. Next is other mental health disorder. Personal history of an anxiety disorder. Research has shown that a significant subset of people who have eating disorder, including 2/3 of those with anorexia, show signs of an anxiety disorder, including generalized anxiety, social phobia, and obsessive-compulsive disorder. Before the onset of the eating disorder, type 1, insulin-dependent diabetes. Recent research have found that approximately 1/4 of women diagnosed with type 1 diabetes will develop an eating disorder. The most common pattern is skipping insulin injection, known as bulimia, which can be deadly. Other than that, dieting and starving. Because of weight stigma, the message that thinner is better is everywhere, and researchers have shown that exposure to this can increase body dissatisfaction, which can lead to eating disorder. Weight stigma is a discrimination or stereotyping based on a person's weight, and is damaging and pervasive in our society. Next, body image dissatisfaction. Body image encompasses how you feel about and in your body. It's sadly not uncommon to dislike your appearance, but people who develop eating disorders are more likely to report higher level of body image dissatisfaction and internalization of the appearance ideal. Last but not least is stress. This is because, number 1, limited social networks. Loneliness and isolation are some of the hallmarks of anorexia. Many with the disorder report having fewer friends and social activities and less social support. Whether this is an independent risk factor of link to other potential causes such as social anxiety. 2. Teasing or bullying. Being teased or bullied, especially about weight, is an emerging risk factor in many eating disorders. The harmful effect of bullying have received increased attention in recent years. Starting an important national conversation, 60% of those affected by eating disorders said that bullying contributed to the development of their eating disorder. Weight shaming need to be a significant part of the anti-bullying discussion, particularly in the context of the widespread anti-obesity messaging. So that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is KHALID bin Hisham, and today I will explain about how to prevent eating disorder. The way how to prevent this eating disorder is for parents to take, so they can observe their children from making any mistake with their eating choices. This is some of the solution you can use to prevent the eating disorder. First, avoid dieting around your child. Second, talk to your child. Third, cultivate and reinforce a healthy body image. And fourth, enlist the help of your child's doctor. Okay, for the first point, avoid dieting around your child. As a parent, you need to always have a dining with your family. Family dining habits may influence the relationship the children develop with food. But if you can't do that because of busy with your work or something else, try to find a chance to have a meal together with your children. Eating meals together give you an opportunity to teach your child about the pitfalls of dieting and encourage them to eat a balanced diet in reasonable portions. Secondly, talk to your child. This way you can tell them about the risk of unhealthy eating choices. For example, there are numerous websites that promote dangerous ideas, such as viewing anorexia as a lifestyle choice rather than an eating disorder. It's crucial to correct any misperceptions like this and to talk to your child about the risk of unhealthy eating choices. Cultivate and reinforce a healthy body image. As a parent, you need to cultivate and reinforce a healthy body image in your child, whatever his or her shape or size. Talk to them about self-image and offer reassurance that body shapes can vary. Avoid criticizing your own body your own body in front of your child. Messages of acceptance and respect can help build healthy self-esteem and resilience that will carry children through the rocky periods of their teen years. Lastly, enlist the help of your child's doctor. Take your child to see a doctor to identify about eating disorder. At well-child visits, doctor may be able to identify early indicators of an eating disorder. They can ask children questions about their eating habits and satisfaction with their appearance during routine medical appointments, for instance. These visits should include checks of height and weight percentiles and body mass index, which can alert you and your child's doctor to any significant changes. This way, you also can be aware of your child's growth. If you notice a family member or friends or anyone around you who seems to show a sign of an eating disorder, consider talking to that person about your concern for his or her well-being. Although you may not be able to prevent an eating disorder from developing, reaching out with compassion may encourage the person to seek treatment. That's all from me, thank you.
My philosophy is that everyone can recover from an eating disorder. A person must become empowered to make the chance to succeed, while taking an active role in their own unique recovery process. Eating disorders are an empty place filled with suffering, self-hatred, masking the disorder, and isolation. My goal is to create a space for people to come, build a community who desire to recover while receiving the support and tools necessary to move beyond a life in the eating disorder. Body Wellness Enterprise has developed a variety of workshops and presentations to educate and bring awareness of the impacts that eating disorders have in our society and how detrimental the effects can have on a person's life and well-being. Workshops are for new parents, clinicians and pediatricians, coaches and athletes, schools and educators, and communities working with youth, because we know that early intervention is the first and foremost way of preventing a lifelong battle with an eating disorder. Come and join us in our campaign.